And then, we've had people now in the study for a year. And, and I'm very pleased to tell you that we've had no one drop out. And that's a very big thing because every study has people, stuff happens and, you end up losing a few folks along the way. But thus far, we've been successful in keeping everyone in the study. It's gratifying. We don't analyze the data until the end, so it'll be 2026 before we get to analyze the data.
Do you have a chance to talk to these people? How do they feel?
I do, in the sense that every month the ketogenic group, the modified paleo group, they get to submit their questions. And so every month I'm making a little video that we get to talk. So I get to answer their questions, chat with them, I give them encouragement. Occasionally people have specific questions that are coming up. And so the dietitians will pass that question to me, and I'll make little videos for specific people. Now, and occasionally, every time people come in and I'm in the office, I will stop down and welcome them to the study. If they're there for their 3-month visit, I thank them for all their participation and everything that they're doing.
How do you have time for all this?
Well,
like, this is just so amazing.
Well,
it's
this is a passion because, I have MS. I had profound levels of pain from the MS, and I was profoundly disabled. I was unable to sit up in a regular chair anymore. I was beginning to have brain fog. It was clear I was going to soon be having to apply for disability. And, I'm back. I don't have pain. Last 2 weeks ago, I was in the Rocky Mountain National Park. I'm out hiking for 3 hours.
I was very jealous about that.
It was
spectacular.
And, I wasn't sure how far I'd be able to hike, because I was at about 600 feet. That we're hiking at about 13,000 feet. Over some pretty rugged terrain. And I was able to do it. And then the following week, I was at the Consortium of MS Centers talking about our research and having conversations. And I'll tell you, that was really fascinating. Because I've been going to this big meeting that has teaches physicians and medical teams about caring for people with MS, and presents the latest research. So very fun, interesting meeting. There are about 2,000 physicians, nurses, and scientists that go there. 5 years ago, when we first started going, nobody was talking about diet. We had our research poster. We're like the only one talking about diet. Now there are a lot of research posters talking about diet, and the presentations, the latest research talking about the molecular mechanisms that drive worsening disability. Those PhD scientists were explaining how diet influences our immune cells, how diet influences our microbiome, how diet influences, do we have accelerated aging that is too fast, or can we slow our aging down? And as I'm walking around, the other thing that was super interesting, people would come up to you and say, "Are you Dr. Wahls?" And of course, say, "Yes, I am." And they'd ask me a few questions about diet, about our research. And then very often they'd say, "Would you be okay? Could we have a little picture together?" My patients would really love that.
Yeah.
Yeah. So,
I can see that.
we're making progress. It will still take more time to have this be universally taught in all of the fellowship programs, that diet really matters. And then we'll have to have the old gray heads like me who still think that diet doesn't matter. They'll all have to retire and be replaced by the youngsters who know that, of course, diet matters. And of course, we have.
It looks like you are not stopping
Yeah,
anytime soon.
you know,
And
my
that's
goal
amazing.
is to still be doing research when I'm 120, still having postdocs in my lab, because I love those youngsters. They are a lot of fun. I love helping them develop their research ideas, write their papers, and then ultimately they'll grow up. They'll work with me for 4 to 5 years, and then they will go to another university and set up their research programs. So I like to think of, and I talk to them, we are like pebbles hitting the water, and you see the rings of influence going across the pond, across the sea. We will change everything, but it will take time, but we are changing things.
Yes. But I love that you said 120, because my goal was 120, and now I just exceeded to 150. So I hope.
So when I get to 120, and I'm still having my postdocs, I'm still doing research, they're like, okay, then I'll have to move the goalpost again to 150. So the goal
Yes. Do you ever have brain fog? Because sometimes a lot of patients with MS, they struggle with brain fog. Do you have any?
Although I will tell you, when I had, at my worst, when I could not sit up, I was beginning to have brain fog. And I'm sure that's why my boss reassigned me to the traumatic brain injury clinic, because he was trying to force me into acknowledging that things were getting to be too difficult. Now, fortunately, I think God had whispered into his ear, because it turned out as I recovered and I realized that, there's so much we can do for those people with traumatic brain injury, including diet and exercise and training, that we turned around that clinic and changed how they practice medicine. And then, because we had such success, my chief of staff and my chief of medicine at the university supported my creating a new clinic called the Therapeutic Lifestyle Clinic. And I ran that for several years. And we took care of people with traumatic brain injury, psychiatric problems, autoimmune problems, and really turned them around as well.
Do you have any stress? Because I know stress is the number one trigger for lesions.
Of course I have stress. We have deadlines this week. We're going to submit a new grant to the Department of Defense, so I have to get everything lined up and submitted by Thursday.
How do you manage stress then? Let me ask you that question.
Here's what I did. So this morning I woke up, did a little 30-minute meditation. Then I did my sauna with red light and red for it's probably about 25 minutes. Took a cold shower, got dressed. And then I'm launched into my day. And I'll do some Nordic walking this afternoon.
It's amazing. I do start every day with meditation, and I just get the red light machine, and it's just and cold shower.
It's a lovely sequence. Do your morning meditation, and then a red light sauna, and then a cold shower. And depending on the day, I may do a strength training on top of that. Oh, and I see someone's asking about cholesterol spiked up. So there are versions of my diet that are low saturated fat, so it's certainly possible. And we personalize the dietary recommendations according to the cholesterol values. So yes, I think we should always follow our cholesterol values and modify dietary recommendations to accommodate that. 'Cause I don't want people to have cholesterols of 300. That's pretty terrible. And so we've done that clinically as a group. The cholesterol values as a group always improve. For the individual who has cholesterol values that are high and get worse, we do a little more interview of what they're eating and personalize the diet recommendations. So yes. Of course, I want people to work with their personal physician to implement these concepts.
I do
yeah,
have some questions
great.
for
Let's
my
do that.
followers actually that I wrote down. So somebody wants to know, actually, I think I know the answer for this question. Does MS still progress while one is on DMTs
Does
like Ocrevus?
MS progress well? What now?
What's
Oh,
somebody is on
so
Ocrevus or any
we certainly
DMT?
want people to
Yeah.
work with their neurologist. You can take the appropriate disease-modifying drug treatment that's been recommended. But in addition, I want to be sure that you are also addressing diet, stress reduction, exercise, so that we can have the very best outcome. Now, some individuals will do so great. They're like, oh my goodness, I don't have any symptoms. I have a clean MRI, no relapses. And I do that. And then the debate comes, and the person would like to transition to a less potent disease-modifying drug. We don't have research that guides how we do that. I certainly have patients who really want to get off the disease-modifying drugs, and I tell them that I would like at least 1 year of great MRIs, no symptoms, before we begin the process of transitioning to a less potent disease-modifying drug with fewer side effects. But we certainly have had people successfully actually even wean themselves off all DMTs. But it's a process. You never do it abruptly.
Yeah. Yeah. My next question is related to that. What is defined a progression in MS? Is it the number of lesions, symptoms, relapses? Nobody knows the answer, I feel like.
Scientifically, the term is that you're getting worse. And an acute relapse, there's a marked worsening of symptoms, and then there's an improvement of symptoms. Can you get back to your baseline? Over time, people after relapse don't quite get back to baseline. And so that's defined as a progression. And then there's another definition of progression. That's progression independence of relapse activity. So that is, I've not had a relapse, but my fatigue is worse. My anxiety is worse. My depression is worse. My hand function is worse. My bladder control is worse. My bowel control is worse. My sexual interest and desire and functioning is worse. So there are measures of disability and all of those things that I've just discussed. And many neurologists have their patients rate all of those functions at each visit, and they can see that I've not had any relapse this year, but my scores on quality of life for all those things are a little worse. That's no, not at
Would all
all.
this show up
Well,
on an
there are
MRI?
research MRIs that can see some newly defined changes, but what's really happening is that the brain is shrinking, the spinal cord is shrinking, and our function is declining. The drugs we have are super good at turning off relapses. They're not very good at stopping the shrinkage of the spinal cord, shrinkage of brain.
But is that
Well,
comes with age, kind of,
what I'm
or
trying
it's
to
an
tell everyone is the scientists are now saying it's because mitochondria are not working very well, because of accelerated aging in these molecular processes that come down to the mitochondrial not working very well, and some cellular processes that accelerate aging. What I've been saying for 15 years is you have to fix cellular nutrition if you want your mitochondria to work, and if you want to slow that aging process. And I can tell you that I monitor this stuff because I'm curious, and it's very handy. I have progressive MS, so we can see what's happening molecularly for me, what's going on. And I've looked at my cellular aging biomarkers. And, the first time I did this, I was like, okay, be prepared, because this is a disease of rapid aging. So you might have biologic age that is far older than your chronologic age, than my actual age. So I sent it off, got it back. I was nervous when I opened up the results. Well, turns out I'm 15 years younger biologically than my chronologic age. And, this is just a testament to the impact of really attending to your cellular function, towards your cellular nutrition, measuring it, fine-tuning it. And that's what I've done as I've continued to tinker with what I recommend in the Wahls protocol. Yes, I do.
Do you still get
And,
MRIs?
I got a young brain, my friend.
That's amazing. That's
Which
so
is
good to
good. So,
hear.
so I'm very excited about that. And I've not had an enhancing lesion or a relapse. I had one relapse, 2004. No, 2003 I had a relapse. Otherwise, it was progressive. And then my nadir was 2007. Since 2007, I just continue to get stronger. When I go see my neurologist, we laugh. So I'm doing push-ups for her. Yeah.
That's great. Somebody wants to know, actually, research is saying that you could possibly stop DMTs after the age of 60.
There are
correct?
research studies that are asking that question right now. One study is stopping the DMTs at 50, one is stopping it at 55, there's another one stopping it at 60. The outcome from those 3 trials have not been published. So we don't know that. I think there are a number of neurologists who consider that because the DMTs are really good at stopping relapses and enhancing lesions, and for most people, the immune system has aged enough that we're just not having relapses after the age of 50. And the side effects of DMTs would, in many neurologists' opinion, outweigh the benefits of DMTs. And there's still a debate. Is it 50, 55, or 60? What is the right age to stop it?
Yeah, okay. One more question. What do you think about stem cell therapy?
Okay, so stem cell therapy for diseases like Parkinson's, it looks like that is helpful for rebuilding some of the damaged tissues. In multiple sclerosis, stem cells do not rebuild the damaged tissues, but appear to reset the immune system. Right now, stem cell therapy is part of the treatment for people who are young, that is under the age of 50, who have aggressive disease that has not responded to the most potent disease-modifying drug treatment. So that's how people are using stem cells. In the stem cells treatment, they generally give, harvest your bone marrow, harvest the stem cells, and then they give you a pretty serious, what called immune cell ablating therapy to kill your existing stem cells. And then they give back the stem cells that were harvested. So it's a very rigorous procedure.
Okay. Thank you. Somebody wants to ask you the question. I am told to exercise, however, due to lack of energy in my left leg, I'm unable to perform such an exercise. What should I do?
Talk to your medical team and ask for a referral to a physical therapist who can help you design a program that fits where you're at right now. and gradually increase your exercise. And there are some things that can make it a little bit easier. Electrical stimulation of muscles can make exercise a little easier. That's a process that's been used for people who have been paralyzed because of a spinal cord injury, for them to maintain their exercise. And that has been profoundly helpful for that population. We now know that there are a number of studies that have used these same kind of devices for people with multiple sclerosis who have much more severe disease and disability so that they can't exercise. And they found that to be very, very helpful. There are some studies that have used vibration plate therapy in addition with the exercise and found that to be helpful. So there are several strategies that we can do, that we can offer our patients to improve their ability to exercise, that have been tested with research. So ideally, you can find a physical therapist who could assist you with electrical stimulation of muscles, with vibration therapy, and or designing a small program that you will gradually increase. You know, and I realized that I did not share the website for people to go look at my study. That's terrywahls.com/MS study. On that.
I also have the form in my bio on my Instagram. If anybody wants to just fill it out, yes. But more information on your website for sure. And if everybody should get this book, because all the information is in wonderful. It's just great.
You know, the other thing that people ask me, are there the people who have recovered that were profoundly disabled? The answer is yes. There's really some wonderful stories. There's a very touching story of a woman who, like me, was wheelchair dependent, very, very disabled. She had a son who was getting married, and her big, hairy, audacious goal was to walk him down the aisle at his wedding. So she was exercising, had gotten my book, learned about electrical stimulation of muscles. We got her hooked up with the folks at NewFit, and she started training. And a year and a half later, this lady who could only take just a couple steps was able to walk her son down the aisle to his wedding. Now, mind you, she couldn't walk down the aisle independently, so she had to hang on to the son while they walked down the aisle. But wow, it's so touching. And then she got to do the, mother-son dance at his wedding as well. So it can happen. You can get remarkable results. You will have to work at it. It's not going to be like a spontaneous generation. You will have to do some work to make all that happen. But it can happen.
It's so interesting that you mentioned this story, because at the end of this year, I'm planning to publish a book sharing another 30 people's stories who are thriving with MS. And I'm just so excited to have this book out, because stories like you just mentioned are in there. And every time I read, I'm the first one reading these stories, and it's just
it's
gives
so
me
important
chills.
that people have hope and inspiration to know that it is possible, that it's worth doing. Yes, it is work. It doesn't happen spontaneously, but if you're willing to do the work and to stay with it, you can make a phenomenal difference. So I am so glad that you're taking the time to write the books. I know that takes time and work too.
They are writing, I'm writing my story, but most people, they are submitting their story. So it's their story, their original writing. We're just editing it.
Good for you.
Yeah, it's amazing. Thank you. Thank you. Thank you so much for taking your time today, again, of your busy schedule. I hope you have a wonderful day, and I hope a lot of people fill out this form and join your research study.
And thank you for all the work that you do.
Thank you. No, thank you. You deserve the credit. Thank you. Have a great day.